Have you ever wondered what certain pains in your body really mean? We all experience aches and discomfort from time to time, especially as we get older, but sometimes our bodies send us signals that are more than just the usual stiffness or fatigue. Some pains are warnings that shouldn't be ignored. They're your body's way of telling you that something might need immediate attention. The trouble is, many of us tend to brush these pains off, thinking they'll pass, or we simply attribute them to age. But certain pains can actually be early indicators of serious health issues, and knowing when to get checked can make a big difference in how those issues are treated. In today's video, I'm going to walk you through 4 specific spots where, if you feel pain, it's essential to pay attention and consider getting checked by a doctor as soon as possible. These aren't your typical everyday aches. They can be signs of underlying conditions that require quick intervention. And catching these symptoms early can sometimes mean the difference between a quick recovery and something more serious. I know it can be tempting to ignore or push through pain, but as someone who's learned from experience, I can tell you that it's worth listening to what your body is telling you. Stick with me until the end, because each of these points offers insight that could be crucial for you or even for someone you know. Understanding these warning signs and knowing what to do if you experience them can help you stay proactive with your health and avoid complications down the line. Each tip builds on the last, giving you a complete picture of which pains require your attention and why. By the time we finish, you'll feel more empowered to recognize when it's time to seek help and take care of your health before a small issue becomes a big one. If you're not subscribed, I recommend subscribing and activating the notification bell so you don't miss any videos. Your support means a lot to me, and if you enjoy this video, you can help me continue spreading these valuable lessons by liking and sharing it. If you like the topic of this video, please comment 1. If you don't, please comment 0 to let me know how I can improve and make better videos for you. So, grab a comfortable seat, maybe even a pen and paper to jot down these points, and let's talk about the pains that matter, the ones that shouldn't be ignored. As we go through each spot, I want you to think about how important it is to stay tuned into what your body is telling you. Listening to these signs is not just about preventing problems, it's about living well, with peace of mind, knowing you're doing all you can to keep yourself healthy and strong. One of the most important types of pain to pay attention to is chest pain. We often hear about chest pain being a sign of heart trouble, but many people still ignore it, thinking it's just heartburn, stress, or muscle strain. The truth is, chest pain can signal a range of issues, from minor to severe, and it's one of those pains that deserves immediate attention, especially as we get older. Heart-related chest pain, in particular, is something that we should never take lightly, as it could be a warning of a heart attack or another serious heart condition. Heart-related chest pain often feels like a heavy pressure, squeezing, or tightness in the chest, but it doesn't always stop there. Sometimes this pain radiates to other areas, like the left arm, jaw, neck, back, or even the shoulders. Many people think that heart pain only happens in the chest, but it can present in these other areas, which is why it can sometimes be confusing. If you ever feel pain or discomfort in these areas, along with shortness of breath, sweating, nausea, or lightheadedness, don't wait to see if it will pass. Get checked immediately. Heartburn and other digestive issues can sometimes feel similar to chest pain, and this is where people often get tripped up. However, the key difference is that heartburn pain is usually related to meals and is accompanied by a burning sensation in the throat or chest. Heart-related pain, on the other hand, can come on suddenly, often during activity or moments of stress. Some people describe it as a sense of doom or an overwhelming heaviness. Even if the pain is mild or comes and goes, it's still essential to pay attention to it. Our heart health becomes even more critical as we age, and any chest pain that's unusual for you or doesn't resolve quickly should be evaluated by a medical professional. In addition to heart attacks, chest pain can also be a sign of angina, which is when the heart doesn't get enough blood flow. While angina doesn't cause the same damage as a heart attack, it's still a serious warning sign that your heart is under stress. This type of chest pain often occurs with exertion and goes away with rest, but it's a sign that there's something going on with your heart's blood supply, and it shouldn't be ignored. Sometimes people also experience chest pain due to inflammation around the heart, known as pericarditis. This pain can feel sharp or stabbing and is usually worse when lying down or taking deep breaths. While it might not be as well known as a heart attack, it's still a condition that requires prompt medical attention. Chest pain can also be caused by other issues like pulmonary embolism, a blood clot in the lung, which can cause sudden sharp pain and difficulty breathing. In all these cases, early detection and treatment are critical. So if you ever feel chest pain that's out of the ordinary, don't brush it off or try to push through it. It's always better to get it checked out and have peace of mind. Many people delay treatment because they're afraid of making a fuss, but when it comes to your heart, there's no such thing as overreacting. Taking action quickly can save your life, and it's a step that everyone should be ready to take if they ever feel that unexpected pain in their chest. Pain in your calves might seem harmless, especially if it feels like a cramp or tightness that eases up after you rest. However, calf pain can sometimes be a sign of a condition called peripheral artery disease, or PAD, which is often overlooked but can be quite serious. PAD happens when the arteries in your legs narrow and restrict blood flow. This means that your muscles aren't getting the oxygen they need, which can cause pain, cramping, or a feeling of heaviness, especially when you're walking or climbing stairs. This pain usually eases up when you rest, but returns once you start moving again. One of the main signs of PAD is this specific type of calf pain, known as claudication. Many people think it's just a regular cramp, but if it's recurring and linked to walking or activity, it's worth paying close attention to. PAD doesn't just cause discomfort, it's also a red flag for other serious health conditions. In fact, having PAD can increase your risk of heart disease, heart attacks, and strokes. That's because PAD and heart disease often share the same root causes: buildup of fatty deposits in the arteries. When one part of your circulation is affected, it's often a sign that other parts may be too. Another reason to take calf pain seriously is that PAD doesn't just affect your legs, it affects your overall health and quality of life. With PAD, everyday activities like walking to the mailbox or going up a flight of stairs can become difficult and even painful. Many people begin to limit their activities to avoid the discomfort, which can lead to a more sedentary lifestyle and affect both physical and mental well-being. Recognizing PAD early can help prevent these limitations and allow for treatment options that can improve blood flow and manage symptoms, keeping you more active and independent. If you're experiencing calf pain frequently, especially if it only happens when you're active, it's a good idea to speak with your doctor. They might recommend a test to check the blood flow in your legs, often called an ankle brachial index, which is a simple and non-invasive way to see if PAD is present. If PAD is diagnosed, lifestyle changes like regular supervised exercise, a healthy diet, and medication can help improve circulation. In some cases, more advanced treatments like angioplasty or stent placement may be recommended to restore blood flow. There are also simple things you can do to support better circulation in your legs, especially if PAD or poor blood flow is a concern. Elevating your legs when sitting, avoiding sitting or standing for long periods without moving, and wearing compression socks if recommended by your doctor can all help improve blood flow and reduce discomfort. Quitting smoking, if you smoke, is also incredibly important, as smoking worsens PAD and speeds up artery blockage. Don't ignore recurring calf pain, especially if it's a pattern you've noticed. It's your body's way of telling you that something's not quite right, and addressing it early can make a big difference. By checking in with your doctor, you can take steps to improve circulation, reduce pain, and protect your heart health at the same time. Calf pain might seem small, but in cases like PAD, it's a warning you don't want to overlook. Lower back pain is something many of us experience as we get older, but there's a specific type of lower back pain that shouldn't be ignored. Sudden, intense pain that comes on unexpectedly and may even radiate towards your abdomen or groin. This kind of pain can be a red flag for a condition called an abdominal aortic aneurysm, AAA, which is a serious issue that requires immediate medical attention. An AAA occurs when the large blood vessel that supplies blood to your abdomen, pelvis, and legs becomes swollen or enlarged. If it bursts, it can lead to life-threatening internal bleeding, so catching it early is critical. Most of the time, an AAA doesn't cause any symptoms at all until it reaches a critical point. That's why sudden, sharp lower back pain should always raise concern, especially if it feels like an unusual or different type of pain from what you're used to. People often describe the pain from a AAA as sharp, tearing, or like a strong pulsing sensation in the abdomen or back. If you feel this kind of pain, it's essential to seek medical attention right away, even if you're unsure. This type of pain is not something to ignore or wait out. Some people also experience other symptoms with an AAA, like a pulsing feeling in the abdomen, unusual weakness, or a drop in blood pressure, which can cause dizziness. But because AAAs don't always cause clear symptoms until they're in a critical stage. Regular checkups are important, especially if you're over 65 or have risk factors like high blood pressure, smoking history, or a family history of aneurysms. If you're wondering why an aneurysm might form in the first place, it's often due to a combination of factors, including age, high blood pressure, smoking, and even genetics. Over time, these factors can weaken the walls of the blood vessel, causing it to bulge. While it's most common in older adults, particularly men, it can occur in anyone with the right risk factors, so awareness is key. Preventing an AAA from reaching a critical point means addressing risk factors where you can. Keeping your blood pressure in check, not smoking, and maintaining a healthy diet all play a role in protecting the health of your blood vessels. Doctors can also screen for an AAA with an ultrasound, which is a painless and effective way to check the size of the aorta. If an aneurysm is detected early, it can often be managed or monitored to prevent it from growing to a dangerous size. In some cases, surgery is recommended to repair the aneurysm and prevent rupture. Lower back pain can have many causes, and not all of them are life-threatening. But knowing the difference between the usual aches and something more serious can be life-saving. If you ever feel an intense pain in your lower back that comes on suddenly, or if you notice any unusual pulsing in your abdomen, don't ignore it. Call for help or go to the emergency room to get checked. It may turn out to be nothing serious, but with conditions like an AAA, you can never be too careful. Remember, our bodies often give us warnings, and it's up to us to pay attention and take action. Lower back pain that's sudden and severe should never be overlooked, especially when it comes with other unusual symptoms. By being aware and proactive, you're not only protecting your health, you're giving yourself peace of mind, knowing you're taking care of your body in the best way possible. If you're still here with me and finding this information helpful, please comment 2 below to let me know. Your engagement helps me keep going, and I'm glad you're here following along. Headaches are common, and most of the time aren't anything to worry about. But there's a particular type of headache that demands immediate attention. A sudden, severe head pain that seems to come out of nowhere and feels like the worst headache you've ever experienced. Often called a thunderclap headache, this type of pain can be a warning sign of something serious, such as a brain aneurysm or a stroke, both of which require urgent medical attention. A thunderclap headache feels like a bolt of intense pain, reaching maximum severity within seconds. People describe it as a sharp, explosive pain that they'd never felt before. Unlike typical headaches or even migraines, a thunderclap headache is sudden and doesn't build up gradually. It may also be accompanied by other symptoms like nausea, vomiting, confusion, sensitivity to light, or vision changes. If you experience these symptoms, especially if the headache is intense and unlike anything you've felt before, you should seek emergency care immediately. One of the primary concerns with a sudden severe headache is a ruptured brain aneurysm, which occurs when a weakened blood vessel in the brain bursts and causes bleeding. A brain aneurysm can be life-threatening if not treated right away, and the risk of lasting damage increases the longer it goes untreated. A stroke, which involves either a blockage or rupture of blood vessels in the brain, can also cause sudden severe head pain, especially if it's an uncommon type called a hemorrhagic stroke, where bleeding in the brain causes pressure and damage to brain tissue. The challenge with thunderclap headaches is that since they come on so quickly, people often feel overwhelmed and may not know what's happening. It's common to wonder if it will pass or if it's just a random intense headache. But the key with a thunderclap headache is its intensity and sudden onset. Most headaches build up gradually, while a thunderclap headache strikes at full force, like a light switch flipping on. Waiting it out is risky. If it's an aneurysm or a stroke, time is critical, and every minute counts in getting appropriate treatment. For older adults, this warning is especially crucial, as age increases the likelihood of vascular issues and weakened blood vessels. If you're someone who deals with migraines or tension headaches, you might think you know what your typical headache feels like, but a thunderclap headache will be different, more intense, sudden, and accompanied by a sense that something is truly wrong. Pay attention to that instinct. Even if you're unsure, it's better to get checked and have peace of mind than to ignore something potentially life-threatening. The good news is that medical advancements mean that if you reach a hospital quickly, doctors have several ways to assess and address the cause of the pain. Imaging tests like CT scans or MRIs can provide a clear picture of what's happening in the brain, and if it's an aneurysm or a bleed, treatments can be performed to stop the damage. In some cases, medications or surgical procedures can help prevent further complications. It's also helpful to know some of the risk factors for these severe headaches. High blood pressure, smoking, a family history of aneurysms, and certain blood vessel disorders can increase the likelihood of an aneurysm or stroke. Managing blood pressure, avoiding smoking, and attending regular checkups are all essential steps in minimizing these risks. Preventive care and lifestyle choices can make a significant difference in maintaining brain health and avoiding potential triggers for these life-threatening conditions. In summary, sudden severe head pain is not something to overlook. While most headaches aren't emergencies, a thunderclap headache is your body's way of saying that immediate action is needed. Trust your instincts, seek medical attention promptly, and remember that catching a problem early can lead to more effective treatments and better outcomes. By staying aware of these warning signs, you're taking an active role in protecting your health and ensuring that you get the care you need when it matters most. There you have it. 4 critical types of pain that should never be ignored. Each of these pain signals, chest pain, calf pain, sudden lower back pain, and severe sudden head pain, can be a serious warning from your body. Our bodies have an incredible way of telling us when something isn't right, and the key is to pay attention to these signals and take action promptly. We often get used to aches and pains as a part of aging, but some pains aren't just part of growing older. They're signs that something more serious could be going on, and they deserve our full attention. By understanding these warning signs, you're taking an active role in safeguarding your health. Listening to these pains can prevent a small problem from becoming a big one. Early intervention often means more treatment options, less recovery time, and the best possible outcomes. We all want to enjoy our years with as much comfort, independence, and peace of mind as possible. And paying attention to these red flags is one way to make that happen. It's not just about avoiding discomfort, it's about protecting the quality of your life. Whether it's preventing a heart issue, catching peripheral artery disease before it affects your mobility, addressing a life-threatening aneurysm, or getting ahead of potential stroke symptoms, each of these pains is a valuable indicator that deserves a response. So, make it a priority to seek medical advice if you experience any of these warning signs. And remember, asking for help or getting something checked out doesn't mean you're overreacting. It means you're being proactive and valuing your well-being. If you've stayed with me this far, thank you. Please comment 3 below to let me know you've taken this journey with me and that you're committed to taking care of yourself. Each of these points might be the knowledge that one day makes all the difference for you or someone you love. By staying informed and aware, you're not only supporting your own health but also setting an example for others about the importance of listening to one's body. If you found this video helpful, please consider leaving a comment below, sharing your thoughts or experiences. And don't forget to like, share, and subscribe to our channel. Your support means the world to us, and it helps us continue to bring you content that inspires growth, joy, and purpose. When we take these small steps to stay informed and proactive, we're not just adding years to our lives, we're adding quality to those years, making them healthier, more comfortable, and more fulfilling. Thank you for watching, for sharing your time with me, and for being part of this journey toward better health and awareness. I look forward to bringing you more content that can empower, guide, and inspire you. Remember, taking care of yourself is one of the greatest gifts you can give to yourself and to the people who love you. Until next time, stay healthy, stay aware, and we'll see you in the next video.